Good evening. This is Ricky Fairley, VP at Sisters Network, and I'm here with my co-host, Dr.
Hi,
Monique
Dr.
Gary.
Monique Gary. How we doing tonight? Thank you
Yeah,
for waiting. We are excited that you could join us tonight. And the doctor is in. We're going to get right to it. We have some amazing and exciting guests. Dr. Donna Adams Pickett, my lovely, lovely soror. Would you introduce yourself and tell us a little bit about your practice, please?
Hi, everyone. Thank you for having me this evening. I'm Donna Adams Pickett. I am an OBGYN in Augusta, Georgia. Owner of Augusta Women's Health and Wellness Center. And the motto for my practice is "We care for you, mind and body." And I'm hoping
great.
tonight that we can convey that care and that care will extend beyond the Augusta area.
That's
That's great.
wonderful.
That's great. And I want to introduce my breastie, Valencia Robinson.
Hi, everyone. I am a 13-year survivor of triple negative breast cancer, and I'm happy to join tonight.
Fantastic.
Hey, Dr. Mo, before we start, we have to say Happy Nurses Day.
We
Yes.
do.
Today is
Absolutely. To
Happy
all.
Nurses Day. So happy nurses to all of our nurses and
Mhm.
everyone on the front line, all the health workers on the front line. We appreciate you. We love you for what you're doing, for taking care of us. So we hope you're having a Happy Nurses Day. So let's talk about sex. Are you ready?
All right, let's get into it. So the format, Valencia, we want you to really just share your story with us. And then we're going to start to talk about some of the issues that arose for you. But I understand you've got some interesting stories to share with us, just about your journey and the conversations you've had with your doctor, and really, share as much as you're comfortable being candid with about intimacy and what it's been like from diagnosis through treatment and into survivorship.
Okay, so I was diagnosed at the age of 33, but I had already had my children. I had a 3-year-old, 4-year-old, 5-year-old, and 8-year-old. So fertility was not an issue when I was posed with the
God bless
question
you.
of having my ovaries removed after I had the double mastectomy. But I did have a doctor, my OBGYN did tell me, he basically told me that I probably would never have an orgasm again. And I said, okay, if it's going to keep me alive, I can do without the orgasms. So after having the surgery, but what he didn't
What a
tell me
choice, right? What a choice.
was the vaginal dryness. I know, right? But he didn't give me orgasm you can live without, but the vaginal dryness, the tingling feeling that you have when your husband has an ejaculation. And for the longest, I didn't even know what that was. Slowly, from conversations like this at conferences, I learned so much. I never had ongoing conversations with my OBGYN, frankly, because you only go there once a year. So you don't have the opportunity to really ask these questions, and you just don't know. You don't know what you don't know. And being a 33-year-old going through menopause, you don't know. So now it's been 13 years, and my doctor, he's so interesting. He will do my vaginal exams, and he's up there doing his exam, and he's like, "Oh my God, your muscles are so good. What do you do? What do you do?" And I'm like, "Will you stop?" But I do a lot of yoga, and I really think the yoga, the strengthening of my body, the stretching my body is also stretching my vaginal area. And it's really, really helpful during intercourse to have that flexibility down there. There are foods that I learned that I can eat, like avocados. Those are the healthy fats that support your vaginal walls, and it keeps it naturally lubricated. So I went to one conference and I learned about vibrators. And this particular model, this is a Fermani. This particular brand was created by doctors like Dr. Donna Adams and Dr. Monique Gary, because they kept getting patients, survivors, and just people in menopause in general who had all of these issues. They want to have sex, it's uncomfortable. So I purchased it, and I have 2 sizes.
Mhm.
And this
Love
was
it. I
this
love
was
it.
just amazing
I
to
love it.
have this option given to me. You know what? Here's my receipt. I just got this last year, March 21st,
She brought receipts.
2019.
Wait, she brought receipts,
13
y'all.
years. It
I
took me
love it.
13 years to
Oh,
find
man.
this.
She
Oh my
brought
God.
receipts. I want to stop you right there. Oh, wait, you got
Okay.
more stuff. I want to, Dr. Donna, can you break down some of what she said so far? So when you see a new patient and they've been diagnosed and you're talking about oophorectomies, et cetera, how's that conversation go when it's between 2 women? Is it the same kind of conversation? And is it because maybe 13 years ago that conversation might have been a little different too?
Right. You know, I don't know if it's different between women, but I know in my practice, I specifically ask the question on every new inpatient intake form, are you having sex? And are you still enjoying it? Because that's
Mm-hmm.
important too.
Right, right.
Right.
And so that's usually enough to kind of trigger the conversation for me with all of my patients. But my patients who are survivors, and I kind of focus on my breast cancer survivors and my other GYN cancer survivors, whether it's uterine, cervical, vaginal cancer. And so we know that the main hormones of sexuality are found in the ovaries, estrogen and testosterone. So whenever we have a patient who has a cancer or a condition where the ovaries are removed, essentially you have a car, your body, without any gas in it. Because the ovaries are gone. So what I try to tease out from the patient to teach them how to make that car run without the gas. It's kind of like, I know I'm dating myself when I talk about this, like the Flintstones car, when they would run their feet at the bottom, the car was still
Yes.
moving. It just wasn't moving the way that we were accustomed to moving. So I like to at first just kind of trigger the thoughts, because particularly in my African American patients, we have to get through some cultural stuff too.
Come on, talk
We
about
have
it.
to get through,
Yeah,
we have to
bring
get
it.
through some cultural stuff, because we were always taught the nice girls
Yeah.
don't talk about sex. They
Yep.
don't think about sex. Rick James has an entire song devoted to it. And she's a very freaky girl, the
Hey,
kind you don't want to bring
don't take
home to
home.
To
mother.
your
Don't take it
mama.
home.
So we start thinking, just because that's not something that's available to us now, but we shouldn't have wanted to enjoy that anyway. But my feeling is that God created your vagina, He created your clitoris for you to use until He calls you back home. And
All
so
right.
I like opening that door so that we can say, okay, you may not have those hormones there, but we can still make things run without them.
I love that. I love that. I'm gonna take it a step further. I'm gonna say for those who are in same-sex relationships and those who are gender non-conforming, the components of pleasure aren't that different, and so
Absolutely.
whether or not it's penetration, whether or not it's vaginal or clitoral stimulation, whatever it is, there are things that we need to talk about and come to terms with. I gave a talk last year at Living Beyond Breast Cancer, and so many same-sex couples in the audience came up to me and they said, we felt heard, we felt seen. I'm single.
Awesome.
I don't have a husband. I don't have a partner. I'm a widower. And you talk to those of us who don't have consistent, regular partners. And I think that's something that we're going to have to get into in a little bit when Tia comes on, because she too is single. So we're going to talk about, how do you maintain good vaginal health and a good relationship with sex and intimacy if you're not seeing someone and you get a breast cancer diagnosis. But Valencia, I know you had some more stuff there in your little goodie bag. I can't see the bag, but I saw some other things coming out the bottom. So what you got there?
In her bed. I love that she's in her bed.
Yes, I'm in my bedroom because I do have 4 teenagers now. And so
Hide it.
when I purchased this little device, my little they also gave us samples of lubricants.
Mhm.
So, and I'm telling you, these things have changed my life. So I have 3 different samples right here in my bed, because these doctors who came up with this because of the needs of their patients, they were like, okay, you may need this, you may use this. So all of these different ones, I purchased this one off of Amazon. Shibari. It's an aloe-based lubricant. It's what we all have. We have to use this. We have to use this. There's no way after having my ovaries removed, going through menopause, I have to have a lubricant. The vaginal dryness is so real. Then I have these vaginal suppositories that I got from my doctor. Reverie is the brand. So you use these a couple of days before. It's like you got to plan out your sex life now, but that's okay, because this is a lubricant along with the lubricant you use when you're ready to have your intercourse. And I'm just so grateful, because I didn't get this 13 years ago. Here it is, 13 years later, when I've suffered for 10, 11, 12 years. Now I'm able to get back to business.
All right. All right.
Dr. Donna, talk to us about the difference between a moisturizer and a lubricant.
Absolutely. Well, one of the things we want is we do want some moisture down there, because again, even if you're just doing clitoral stimulation, you don't want that dryness. It's very difficult to just have that sensation if it's very dry down there. And so a lot of the water-based moisturizers, they're kind of good for the moment. But just as you mentioned that when your partner would ejaculate, you have that stinging and burning because the skin was already, the tissue was already dry.
Right.
Yeah.
So what you would like to do is have something that ideally could kind of increase the stretchiness of the tissue.
Yeah.
You know, part of the sexual response is the elongation of the vagina to accommodate your partner, but it's very difficult to do that if the tissue is very brittle. Some patients, particularly those who do not have estrogen or progesterone receptor positive breast cancers, they could benefit from some topical estrogen. And because that's going to allow tensile, basically the stretching and pulling of the vagina so that it can accommodate your partner or your toy whenever you need that. But you mentioned some of the lubricants that you like. Some of the things that I like to mention to my patients are CBD. See, they're
I was getting to
yes,
that. I was just
ma'am.
going to get to that next. Absolutely.
You
Talk about it.
I'm
you
taking
had
notes.
some. Now you had props. I got props too. Okay,
I
I
love
got
it.
props
I love
too.
this. All of it.
So this is Foria spray.
Mm-hmm.
And it is a CBD spray, but Foria just for the vaginal area. Foria has the CBD spray and the CBD suppositories. Now you gave a great point that sometimes you have to plan when you're going to be intimate, and that's what the suppositories are very helpful for. They actually change the tissue. They alter the tissue architecture. They make that tissue very stretchy and pulling. But the spray, if you spray it just on the clitoral area, not even 10 minutes before intercourse, it actually heightens sensation and increases the orgasmic experience.
Wow. Okay. All right. That's
So
good.
it is very beneficial because it actually changes the architecture of the tissue. And again, you don't get a lot of systemic absorption. You don't get a lot of it going into the bloodstream. It is right directly on the tissue and changes the architecture. Another type of lubricant that you were mentioning, this is a silicone-based lubricant. So you talked about the one that has a aloe base, which is great. The silicone-based lubricant, this is Uber Lube, and they have it on Amazon. I give it to my patients freely. I mean, I give it to them like I give out chocolate. I'm like, and
I
For
love
being a
it.
good girl today, you get you get a nice scoop.
You're a good girl.
Mhm.
And very helpful because a lot of your water-based lubricants, they will actually begin to dry during the friction of intercourse. So
Mhm.
you
And make
want
it work.
something
Yeah.
that's a heavier base,
Right.
like the silicone-based lubricant or the aloe-based lubricant that you mentioned.
Mhm.
But really, really, people need to start looking at the CBD supplements. Another thing that I often prescribe for my patients is like a topical, we call it screen cream.
Mm.
And
Tell us
it
about the
is
screen cream.
Spring cream. Okay.
Scream.
cream,
SCREAM, like scream, right?
Oh,
scream
screen
cream.
cream.
Scream
All right.
Like
cream.
I look,
Okay.
listen. I have been at some very hoity-toity affairs, and I've met the partners of some of the patients to whom I have prescribed the screen cream, and they're like, "Oh, so you, Dr. Pickett? Give me that." So
Mhm.
screen cream is topical sildenafil, which is Viagra. So it's a compound made of Viagra and usually another compound like arginine, something that will increase blood flow to the area. So in addition to making the vaginal vault stretchy, moist, it increases blood flow and will make one scream.
Mhm. Mhm.
All right.
Yes,
So
it
so
will.
we're in
Yes, it
the
will.
era of COVID and we can't go to the doctor. How can we get this?
So typically, so I actually use a U.S. mail-based pharmacist that for my patients, I actually send the prescription
Mhm.
to the pharmacist in Texas, and then they send it to the patients. There
Mhm.
are some states that do not allow um,
Mhm.
pharmaceuticals to be shipped, and under those circumstances the compound is shipped to me, and then I am able to send it directly to the patient.
You're gonna get
Mhm.
a lot of prescription orders today.
You are. This is
I
really
can
good,
do
Dr.
my
Donna.
part.
Listen,
I
I'm
can
going
do
to hit
my
you
part.
up for the exact ratios of the screen cream because I have heard of screen cream, but I have not prescribed it, and it's great to know that it's mail order. That is
Oh yeah, oh
huge.
yeah. I mean,
Absolutely is. Now, I want to talk about scars. I want to talk about reconstruction, because a lot of what happens with breast cancer patients, I talk to them, I say, we're asking you and we're telling you, okay, go out and live your best life. Go and love yourself. Love your body now. When you didn't love your body before breast cancer, you didn't like your love handles, your curves, your nipples, you thought your areolas were too big. You weren't having great sex before. Now, all of a sudden, we're like, okay, new lease on life. Go for it. Love
right.
yourself.
Mhm.
And so I want to talk about some of the changes that happen to a woman physiologically and also psychologically as a result of breast cancer treatment and how that impacts your intimacy. Because before we can get to the sex, we might
Right.
want to back up and talk a little bit about the intimacy. Valencia, can you give us a little bit of your story in that regard?
Well, what I can say is that I cried a lot because it was jarring, it was shocking because I
Yeah.
tried to have reconstruction and it was failed. The expanders, I had a bad infection. So whereas I'm looking forward to having my new boobs after breastfeeding 4 children, then to find out I can't, under no circumstances can I have this. I had to have the expanders removed. So it was very, very difficult. Very, very difficult. The healing process from having the expanders removed after they were placed in, and after I went through all of that, I said, I'm not going to try it again. The doctor was like, you can try again in a couple of years.
Mm-hmm.
So a couple of years later, I had gotten myself together. It's like, okay, God, I'm alive. I survived triple negative disease.
Mm-hmm.
Who cares if I have breast? I mean, I see it every single day when I shower, when I work out. But at the time, I would wear a bra all the time. Now it's like I'm flat. There's a whole group of us who are flat advocates. We love it. We embrace it. It took time. It took
Mm-hmm.
time. But when you look at when I see my other sisters dying, it's like you
Right.
quickly get over that. You're like, who cares about boobs when I have
Mm-hmm.
life? I have health. I have strength. I'm gaining my strength. And each person's journey is different because my boobs were, some people just really, really, really are attached. I was not as attached, I guess, because they were sagging and drooping after 4 kids. And if it meant that I could live, I'd
Right.
rather live. I'd rather live. And 13 years later, who cares? It's like, who cares? I'm a survivor. I'm alive. And I'm not going to go back to get the surgery. And my sister was diagnosed 3 years ago, so I had to go through this again. And I'm constantly going through it when I see other patients who have problems with their expanders or their reconstruction surgery, the implants. It's so many things that come up all the time. And you think, okay, you know what? I'm glad I didn't go back then try to do it, because people are just having issues with so many things dealing with the implants. So I'm just grateful. And it was tough. I can't say it wasn't tough, but 13 years later, I'm so happy with the decision I made, and I'm alive, and that's what matters.
It's really great that you're able to get to that point. And I want to ask very specifically, as I've been troubleshooting with some of my patients about things like, I'm just going to like porn, things to stimulate and enhance your libido. For that patient, it was a reminder of something that was missing. So how do you begin to stimulate your sex drive without those feelings of shame and all the things? Give me a little bit of the early journey. Yeah. Okay. Talk about it, right? Because the physical may help supersede.
And you know what? Here, I'm sitting here in my bedroom, right? I have my diffuser going.
Love it.
I have my fresh flowers that I got from a local farm. My bed is made up. You have to I got my organic hand and body lotion. I shower. I just find joy in taking care of my body. I do my yoga. I do my stretching. I do my exercise. You have to love the body you're in, and you have to embrace what you can. You have to embrace what you can. You can't get hung up. I was never into porn. That just wasn't me. Well, I should say this. My husband is a full-time pastor. So that being said, and I got teenagers, that's not something that I want my kids to grow up watching. And they may, and I think sometimes they might, but look, that wasn't a part of my life. It was prayer. It was, my family. There's so many things. I'm a teacher, and I had to teach during this difficult time. I'm still teaching. So I have a lot of things with the 4 kids and them going to college. I have so many things to preoccupy my time when I am not working and advocating, that I'm just not getting caught up in other things. And that's just for me. So I just try to have a balance, taking care of my body, keeping my mind, my meditation, walks on the beach, line dancing. We were talking about dancing earlier. I just have groups of people that I am connected to that make me feel good about who I am.
That's a key. I think that's a really important thing that you said. When you talk about acceptance, you have to accept the things you can't change, right? Change the things you can, but the things you can't change, really accept. And then you're filling your life with things that are meaningful to you and that represent that acceptance and the love of your body, or honoring your body. Did you do yoga before breast cancer?
I did not. My oncologist told me to try yoga. It was the hardest thing. After recovering from my mastectomy, I would sit in yoga and cry. And I'm like, how can these people do these poses? Just downward dog. I felt sick and nauseous. It was terrible. And she said, you got to keep coming. It was so hard. When I tell you it was so hard. But now, girl, I am the yoga queen. I can do it all. And I'm grateful for my oncologist. She kept pushing me and she kept pushing me. And she let me come to her office to do yoga with her staff. She did yoga with her staff 2 days a week. And she's like, you need to come. You need to come. She wanted me to, initially she told me I may not make 5 years. So she was doing everything she could to help me beat those odds, and I beat them. So yoga is just so great for strengthening your body and your arms after going through all of the surgeries and the scarring and everything.
Yes.
Right.
Yeah.
Right.
One of the things I really try whenever I have a patient in this situation, I try to get them to encourage them to revamp what their idea of what's attractive. Because especially like you said, Valencia, some women are they feel that they are tied to their breast. That's what makes them attractive. And one of the things that I always tell them, if you put 10 men in a room, some men are going to say they're butt men. Some men are going to say they're leg men. Some are going to say they're thigh men. And there are going to be some that are boob men. But from that, we see that attractiveness takes on all forms. Some will say, I like a woman that's smart. Once she opens her mouth, that's it. You know. And so what I try to encourage them is to, find other parts of you. You were more than just a pair of breasts.
Yes.
Before this diagnosis.
Right.
When you walked in the room, those breasts were attached to a person. What other parts of you are attractive?
Right.
And, for those who have a barrier or discomfort with porn, I'll say, well, what about just some basic erotica? I mean, there are some, you can read a story that has enough suggestion to it
Very
that
true.
will make you fan yourself with the book.
I love it.
It's like,
Right.
I don't know if I can turn the page. And so it really is about trying to expand what you had been thinking was normal for you. It's a new normal.
Right.
It's a new normal, and embracing it and saying, okay, what other things can make me feel? Because ultimately the end result is how you feel. What other things can make me feel as good as I felt when I had the breasts?
And I think you really do have to spend some time with yourself.
You do.
In the mirror with your scars. I talk to patients a lot when I see them in clinic about their scars, what they feel like, about your chest, about your skin. Where does the sensation stop? Where does it start? And figuring out what feels good to you again. And really, I use the term centering your own pleasure. Because if you don't know what feels good to you, even in the absence of scars, our partners, our spouses they're timid. They don't know whether to touch. They don't know to advance. They don't know if you're tired. They don't know what to do and how to navigate. And so you really have to sort of take the lead to figure out what feels good to you so that you can then help you feel good and build that confidence as well. And so there's a little bit of self-work that has to happen, I think, as a woman rediscovers your intimate self. And there's going to be some crying, and there is going to be some grief, and there's going to be some shedding of some things that you thought, the you thought you were going to be. And if you can get to that point of acceptance, oh baby, right? I read an article, a woman, she said, I never had sex as good as when I got breast cancer.
Wow.
And I'm reading this article, I said, are you kidding me? And she said,
that would be me.
For the first time, my pleasure wasn't centered around somebody else. It wasn't centered around that person's experience. It was finally focused on me and what I liked. And what
you become a badass. You become a badass.
Tell me about being a badass, Ricky. Come on, chime in here.
Become a badass, and you become more demanding of what works for you and what you want. And it takes you a while to get there. But one of my besties who's no longer here said, you need to get a shower head and just go in the bathroom and lock the door. And that's what I did. But also I think, I had to get rid of my husband and find, other partners that care about. But you have to tell them what you want. And I think we get this badass confidence about us that makes us say, all right, this is what works for me. Or guess what? This doesn't work for me. And it's not about you. It's about me.
Right.
And on the subject of erotica, there are books, there are romance novels and erotica that are centered around characters with breast cancer.
Right.
So that is something that women may want to look into, because if you're having trouble viewing yourself as a sexual being and really connecting with your body, if you've not had reconstruction or if you have scars, it may be helpful for you to read that, that acceptance and that erotica and kind of get into that zone.
Right.
Right.
And Dr. Mo, one of the things I also want to add is
Mm-hmm.
even if you're in the midst of treatment, and let's say a patient did not have a mastectomy, and maybe
Mm-hmm.
they had a lumpectomy, but they're going through chemo and they have hair loss,
Right.
and again, they're not feeling well, but they want some intimacy. They still want the hugging and cuddling, and those are the patients. Again, if their beauty was tied to their hair, that's when I suggest get some color scarves. This is the
Right.
time you can be Sheba.
Mm-hmm.
This is
Anything
the
you want.
time to
That's
do some
right.
fantasy,
Mm-hmm.
take that nap, have some nausea medicine, and make a date with your partner tonight at 10 o'clock. I'm gonna take
Right.
that Zofran at 8, and
Right.
at
Right.
10
Come on, talk
You're
about
right.
that. That's
at
right.
10 I'm going to be, I'm gonna do some belly dancing. I'm gonna tie my head. I'm gonna have a turban. I'm no longer
Mm-hmm.
Jill. I am Jasmine.
Mm-hmm.
Right.
All right, Jasmine. Yes, honey.
Right. I know that's right.
So
I
so
absolutely love that.
I want those patients, even in the midst of your cancer treatment,
Mm-hmm.
um to still enjoy the intimacy. Don't So a lot of times, if you don't feel well and you feel like you can't perform,
Mm-hmm.
I always say go into the hugging and cuddling without a goal. The goal does not have to always be intercourse. The goal can just be feeling very close and just
Mm-hmm.
rubbing bodies next to each
Yes.
other, just
Right.
feeling your body and enjoying it with someone else in a way that
Mm-hmm.
you're not thinking about the illness.
Yeah.
And once you take that pressure of, but this is going to end up in intercourse, and I may or may not have an orgasm, he may or may not have an orgasm, she may or may not have an orgasm,
Mm-hmm.
that's a
Mm-hmm.
lot of pressure.
Right.
So if you can just focus on the intimacy and the closeness even during your treatment, that would
Mm-hmm.
be helpful.
I
Yeah.
love that you said that. And it's so hard right now during COVID as we tie in, a lot of what we're talking about to COVID and breast cancer.
Right.
I gave a talk earlier today on that very thing. I'm a hugger, and I realize that many of my patients don't get touched. They don't get hugged. I rub feet before surgery. They're nervous, and you're going to sleep. Anesthesia's at the head. I'm at the foot, doing a little bit of foot massage, getting in some of those pressure points, and trying to make sure that we get in some touch, because many of us, especially people who aren't partnered, people who are widowed, who are single, they're not getting the level of intimate touch, hugs, cuddles, things that we need just to survive, just to connect with ourselves and with humanity. And so that is such an important thing. And I tell my couples, because they'll bring their partners and spouses, and I say, listen, you have to set really realistic expectations, because if you have not done anything in several months and you guys come together and this is your one date night every 3 months and you're expecting fireworks to happen, it's not going to happen.
Right.
So maybe the goal is you just maybe go sit in the car and just go kiss and canoodle for 5 minutes, and nobody feels guilt, nobody feels shame, and nobody feels pain. Like, let's just start there.
Absolutely.
And if you can make it through that, anything else is bonus. Like, that's a win. You need a win under your belt, Just start
Right.
there. And then the next time, maybe don't wait 3 months. Maybe we'll go 2 weeks from now. We're going to do this again. We'll do it a little bit longer. And maybe this time we'll get to wherever else you mutually decide is that next step. But you got to walk it out. Because if you just expect to have amazing sex after breast cancer,
Right.
you may very well be disappointed.
Right.
Yeah. Yeah. And now with COVID, they're afraid of germs. Like when I was on chemo, I was afraid for anything to touch me. You're so paranoid of, catching something. And now we have COVID that makes it worse, right? But
Shower together,
I
have
was,
at it.
yeah, I was petrified to don't touch me. Like nobody should touch me,
Yeah, but we gotta get to that point. Valencia, tell us how we can reach you on social media and about your advocacy work, and especially about those you mentioned people who didn't have Reconstruction. You have a good network of sisters. What'd you call them?
Flat advocates.
There you go. Your flat advocates. How can people find and connect with some other flat advocates if they're so looking?
I forget the name, the official name. I'm in all these groups. It's just too many groups.
Yeah.
But I think I'm gonna type it in the chat. My social media. I'm looking at some of the chats, and a lot of the people already know me. We're already connected, and it's great. It's great.
Yeah.
Thank you for the comments. But one thing that we haven't mentioned that some of my survivor friends, and these are older women, they just cannot have sex anymore. And all they do is oral sex. And that is how they make it. They get their orgasms and I was going to say that earlier, but now it's like the right time to say it, because the older I'm 47, the older I get, my vaginal walls are going to keep thinning. So there may come a time when I can't have intercourse at all because I had my surgery so young at the age of 34. By the time I'm 74, who knows what it's going to be like down there, you know?
Sure.
So, but that's what my older ladies, and they talk candidly about it, their oral sex, and that is what makes husband happy, wife happy. Hey.
Right. Everybody's happy.
Penetration doesn't do it for everybody. You know,
Right.
the LGBT community, you know, it is a part of some people's intimacy and not others. And so whatever pleases you, whatever makes you feel good is what you should pursue and what you should prioritize, you know, and to the benefit of each other. And those are some really honest conversations that have to happen between you and your partner, you know, about what feels good and what doesn't. And if penetration doesn't feel good to you and you never liked it before, it's a good time to speak up now, isn't it?
Right.
I'd like to dovetail off of that quickly, because you're right. A lot of the patients cannot tolerate penetration. So when you mentioned toys earlier, there are a number of toys that are non-penetrable, that they just focus on stimulating the clitoris. And I have one here today. This is the Lilo Sona.
Talk about the Lilo, yes.
And again, it's just a clitoral stimulator. So for those patients, again, who don't have a partner, they can't perform oral sex on their self, and their vaginal walls are too dry and uncomfortable. I mean, the Lilo Stona, right up there, you'll just get that clitoral stimulation, which is what the stimulation you'll get from oral sex. And I've had patients who have offered to make this thing macaroni and cheese and take it home to mama, because
I heard somebody say grits.
So you know, but it's great because for those who penetration does not work for, it's just, and you have patients who dread intimacy because they're dreading penetration. And so this is something, and that the partners can use with their patients, and then everybody's happy.
Right.
Absolutely. Yeah.
Great.
Well, we have another guest. We have another breastie. Valencia, I hate to see you leave, but we only can have 4 on at a time.
Okay.
Let us know how we can follow you on social media. If people want to chime in and chat with you or follow you on Instagram, any of those things, you want to give us your handles real quick?
Yeah. My name is Valencia McMillan Robinson on Facebook, and at Valencia1340 on Instagram. I'll put it in the chat too.
Okay, perfect.
Thank you, Breastie.
My goodness, we appreciate it so much.
Meeting
you again, okay?
Okay.
Take good care. Ricky, who's coming up next?
Bring on Tia Tomlin, my other breastie, Tia Tomlin. She's from Atlanta, and she actually runs a foundation called My Style Matters, but she has a great network of breasties in Atlanta.
There she is.
Hey, ladies.
Hey, Tia, you want to talk about yourself and what you do and tell us a little bit about your story? And she has a great story of body image that I think is really important for this conversation.
Let's hear it. Let's hear it.
Yeah, so, you know, I'm Tia Tomlin. I'm a triple negative breast cancer survivor, was diagnosed back in 2015. Started a sisterhood called My Breast Years Ahead on social media, on Facebook, to connect women in Atlanta, in the greater Atlanta area together, and then started a nonprofit called My Style Matters. So that's how my advocacy began. So in terms of my sexuality, you know, one of the things that I was challenged with when I was diagnosed, first and foremost, is having to make that decision about whether I'm going to have a lumpectomy or a mastectomy was the hardest thing ever that I had to make. And it wasn't so much having a mastectomy, it was the fear of losing my nipples and areolas. And part of that was being single, living in Atlanta.
And young.
yeah, and young, not having children, I struggle with that. I really, really struggle with that, more so than even making the decision about chemo. I start feeling like, is anybody going to want me? Anybody going to desire me? Will they love me? Dating is hard as it is, and then you take that element away from me. Not that I wouldn't feel feminine, but it was just dealing with that emotion of having a partner, getting married, and the things that I truly desired. And so, when I learned that I didn't have to lose my nipples and areolas, that I could actually have a lumpectomy with reconstruction, reduction, and then go back and have a mastectomy and still keep my nipples and areola, I was like really happy about that. But then after having the surgery, I had scars. And so the scars really affected me emotionally, because I just didn't know, would anybody, again, still having those same feelings, would anybody desire me? Would anybody want me? Not having, still having my breast is now smaller, but now having the scars. So, so going through that process, one of the things that I did, and I'm not going to, sit here and brag about it, I guess you could say, but I needed to get over that. And I found myself blocking myself from getting what I truly desired, which was love. And so I made a decision to, can you guys still hear me? Okay, good. I know it's a little windy here, so I don't know if my connection is going in and out, but one of the things that I did was I needed to get over what I was feeling, and I kept blocking myself. And so I made a decision that I was just going to be intimate with someone. And I chose someone that I've known for years, someone that I was, had a good relationship with. We actually dated, a while ago, had never been intimate, which was funny. And so when I made the decision, I was just like, you know what, I'm going to do this. And I made, it happened. And when we were intimate, first of all, it shocked the mess out of the person. They're probably watching now, so I'm chuckling a little bit. But when we got intimate, they actually made the decision to turn the lights off. And I said, no, keep them on. And it wasn't about them. It was about me. It wasn't even about the act of sex. It was about me having the confidence in the new me, because I had lost who I was at one time after going through my own journey. And so, we had sex. I mean, it was what it was, but I found that I was okay with it, because I just wasn't sure. I was afraid of how he was going to respond. And, was he going to treat me different because of breast cancer, not just, the scars, but also just being diagnosed with the disease itself. So that was one of the ways that really helped me to get through it. And like I said, it wasn't about him at all. It wasn't about sex. It was about me finding the confidence again in the new me.
Wow. I love that you said that. I was in a car accident, a rollover accident in my senior year in college. I went through a windshield. The car rolled over 3 times and landed sideways in the grassy median of a 6-lane interstate. And I went head and hand first out the back window. So my face got scarred. I had glass in my scalp. I degloved an entire hand. I don't know if you guys can see my little bum hand here. And I have road rash from shoulder to shoulder. And it took me so long, because I wasn't a particularly confident child. I was always sort of the quiet, introverted child. And when you have childhood trauma, like my mom died when I was young, I was very introverted. And so I just kind of gotten a little confidence in college. I joined a sorority and I'm rocking and rolling. And all of a sudden you go through a windshield and now you've got these scars. And now your fingers are filleted open and you got from here to here. It looks like Freddy Krueger went across the shoulders. And I remember how long it took me to just get enough confidence to wear a tank top, to wear something with my back out. And so it influences now how I do surgery, because I do a lot of what's called hidden scar surgery. I hide the scars under the breast, around the nipples, under the arms, wherever we can hide a scar, so that you don't have to feel like scars are what's defining you in your diagnosis. But, I have to counsel my patients.
Yeah, I lost you all. You still there?
Even when I do a nipple sparing, you keep your skin, keep your nipples, and they look great, but you don't have sensation anymore. you can't feel them anymore, right? And what does that do to your sense of intimacy? How is your sense of sexuality tied into your nipples and to that sensation? And what are you going to do without that? And begin finding new erogenous zones. And you made some really good points there. You talk about your scars and your nipples, because even after reduction, the sensation can be very, very different, you know? Are you still with me? Can you hear me, guys?
I can hear you. Can you hear me?
Perfect, perfect. So Dr. Donna, talk to us a little bit about the psychological component of this,
Looks like I'm frozen.
to even get to start using some of these things.
Well, again, I think it's, a matter, as I mentioned before, redefining what's attractive to you. And when you think about it, most of your partners will tell you over the years, nobody wants to do the same thing over and over and over again. Along those lines, you don't
Yeah, I
want
think
to
I'm
get.
frozen. I can't hear you if you can hear me.
We can hear you.
We can hear you.
We can hear you. We want to expand our idea of what is attractive. Again, I think when I look at scars, I tell people that they tell a story. You started out when you were born. For most of us, it's just a clean slate. And that by the end of your life's journey, you may have a C-section scar. You may have the scars that you have. You may have the breast cancer scar. You may have had a hysterectomy with a stem to Stearns. They tell a story. They're part of your story. They're part of who you are. And it's nothing to be ashamed of. And I think that's where we have to get into that mindset of this is something to be very proud of, that we are survivors.
Absolutely, absolutely. So
I
Tia,
lost you guys.
okay, I don't think she can hear us right now. Dr. Donna, we're gonna keep talking. We're gonna talk to me a little bit about, here's the long word for it. The long word is photobiomodulation therapy for vaginal tissues. Let's talk about what can we do for the vajayjay.
Well, there are those who they actually do fellowships in vaginal reconstruction and laser therapy
Yes.
that basically, remember earlier I mentioned how part of the sexual response is the elongation of the vagina, a stretchiness of the vagina that we lose. And so there are photo laser therapies where one goes in weekly for a few minutes at a time that basically rejuvenates that tissue and teaches that tissue to behave like it did when you were 21 as opposed to when you were 51.
Now, talk to me, because there's the laser therapy, which I've had some patients who have gone through that process and with varying degrees of results and level of comfort and also expense. And then there's some other things like the funny story I tell is that after I gave that Living Beyond Breast Cancer talk about sex and intimacy, 2 weeks later, these 3 cases of something called a V-Fit, a sonic vaginal warmer, showed up at my door. And I'm thinking, they can't possibly think I'm some kind of an influencer. I have 50 friends on Instagram. But, and it was a mistake. It was sent to the wrong address, but it was sent to the right address so that I could tell people about this. This is a V-Fit. And it is a warmer. And so the lights will come on. It is a phototherapy. So the lights, it will vibrate and it will create heat within the vagina in order to stimulate and increase the blood flow. I cannot attest. It's the first time I took it out of the box here. So I can't attest to how well it works. But the woman on the website said if my house was on fire, I'd save my V-Fit first. It is something to look into. I mean, it's a $500, $400 vibrator, but if it's something that can help to have a lasting effect by increasing warmth, increasing the blood flow, and thus hopefully the thickening of the lining of the vagina, for some women, this may be a cheaper option than, say, laser therapy.
Right.
Have you seen good success with vaginal rejuvenation for your patients?
I have, but again, it's very expensive. And so for many patients, I will often just steer them to pelvic floor therapy. We have physical therapists that'll help us learn how to walk again. And we have occupational therapists that'll teach us how to eat again. But they're actually pelvic floor physical therapists that will teach you how to relax the vagina. They actually have dilators that you can use to help
Mhm.
open up the vagina. So
Mhm.
those are options that actually are not as intimidating to most patients.
Absolutely. And somebody said they couldn't see it. I'm gonna hold it up again because my screen got cut off. But this is a V-Fit. It warms, it vibrates, it has lights, and it's supposed to be used therapeutically for at least 5 minutes a day in order to increase blood flow to the vagina. Let's see. Wait, can you see it over there? It is over there. It is kind of it's a little hefty here, but absolutely, I think that pelvic floor physical therapy and you know those therapists are really wonderful resources for our patients. You are absolutely right. I know we have them at our hospital too, and it's something that patients should not be afraid to discuss. And on that note, let's talk about that conversation with doctors. It sounds like Valencia was had a great conversation with her doctors.
Right.
I think Tia sounds like she might have had some discussions, but Dr. Donna, I'm sure you see some patients and you go to some support groups and you hear some stories of people who they didn't know what to expect. 80% of men with prostate cancer get counseled about sexual dysfunction from diagnosis. Only 25% of women with breast cancer even hear the word sexual dysfunction, and that's later in their journey after surgery, after chemo, after radiation. Nobody's talking to women about sex. How do we talk to the people who are watching to help them have that conversation?
Well, again, I think we go back to the cultural thing. We have to just remind patients that it's not taboo to bring up the subject of sex. And when you talk about, you mentioned how much counseling men receive with prostate cancer. Remember, how long ago did they discover Viagra and Cialis? And we as women just got a pill to help with our libido 2 years ago, Adii. So this is when we as providers, we need to incorporate it into our routine exam, because as I mentioned, I have it on my intake form. And I can't tell you how many patients are like, thank you for bringing this up because now I can walk through the door.
Yes.
I have encouraged our local breast cancer support groups, actually offered my services. I would love to come do a talk with you about breast cancer and intimacy. And I've had patients who then came to my office and said, you gave me my life back.
Wow.
Because many patients are like Valencia, diagnosed in their 30s.
Yeah.
And they thought, well, then that shop is now closed. And now with modern technology, again, we can identify an organism on Google in 0.8 seconds. Why can't we make women feel better about themselves even after a cancer diagnosis?
You're absolutely right. I know I've been working to change the intake forms in my office and in many offices, because the easiest way to get people talking about it is just to say, are you satisfied? Like you said, are you satisfied with your sex life? Are you having sex? Are you satisfied with it? And would you like to talk to somebody about it? And if they answer yes, then that opens the door for physicians who maybe aren't so comfortable having this discussion, because there are many doctors who don't receive any education in this. I don't recall having a whole lot of education about this in medical school. It's certainly not in general surgery residency, where I was the only female resident, and and now all of a sudden I'm in practice and patients are saying, well, what can I do? How can I get my life back? How can I get my sexy back? And so we have to do a level of research and education, in order to be comfortable having these conversations with patients, tell them what to expect and how to get it back. Ricky, what are your thoughts?
It's okay to talk about it. I think part of it is it's okay to talk about it. It's okay to ask the questions. And, we have to sort of get beyond ourselves and really, know that it's okay. You don't have to ask your mother. You don't have to ask anyone's permission. This is your body. You own it. And you getting used to your new normal. It's okay to talk about it. It's okay to bring it up. And with every part of, the cancer experience, it's okay to advocate for yourself. It's just, part of it, but you shouldn't give things up. You have to live your best life, and sex is part of it. So,
it's more than just, absolutely, pleasure is not optional. It's your right.
Right.
Absolutely.
You have the right to have great sex at every point, have good intimacy and great sex at any point in your treatment journey. If you're on chemo, have hair, no hair, have breasts, no breasts, have ovaries, no ovaries, have a partner, no partner, have some really good intimacy and good sex with yourself.
With yourself,
Pleasure. Self-pleasure is such an important part of this journey, that intimate journey, because the better you know yourself, the better you're able to help your partners and guide your partners and be comfortable in your experience. And that's a place where we really do have to get to. Absolutely.
Right.
So Dr. Donna, let's sum it up here, because you gave us a lot to talk about. I want you to talk about CBD, like give the, the tips and the hints and tell people how they can find you also. But to recap for people who just joined us, talk about some of these products you're recommending.
Well, thank you again for having me. This has been fun. I have enjoyed every bit of it.
You're here.
And I hope that our listeners will see how much fun we're having talking about it.
Right.
So now you know this is a subject that you can touch upon. There's no scariness around it. The Foria CBD oil, you can find that online. The Uber Lube, you can find that on Amazon. The Lilo Sona clitoral stimulator, you can find that online. I am on Facebook as Donna Adams Pickett, as well as Augusta Women's Health and Wellness Center. On Instagram, I'm known as Doc Times 2. And one of the things I just want to just seal the point that Dr. Mo made about pleasuring yourself, because in the beginning, you typically are not going to feel comfortable with someone else until you feel comfortable with yourself. And what I often tell patients, I said, how many times have you said to someone, if I want it done right, I got to do it myself?
Come on, talk about it. Yeah.
Right. So if you want to make sure that someone can bring intimacy to you in a way that you are comfortable and at peace within, take care of yourself.
I love that so much.
What about the Scream Cream? What about the Scream Cream?
That's right. Ricky's like, don't you get off this? Oh.
Again, you started something. You opened up a can.
I opened up
all,
a can.
All my patients who are watching, my patients don't be on social media. They're gonna be calling my medical assistant asking for Scream Cream tomorrow.
The can of good times. So Scream Cream, if you have a compounding pharmacy in your area, it is a compound of sildenafil, which is topical Viagra, as well as arginine, which is increases blood flow. Now, some local pharmacies, we have a local pharmacy here that only does the topical sildenafil, but they also do a topical testosterone. And again, if you are a negative receptor cancer patient, that would be beneficial for you. But ask your physician about that your physician can prescribe that and have that sent to you from any compounding pharmacy.
Well, there you have it. I mean, I think the verdict is still out, at least from the breast surgeon standpoint, about testosterone and estrogen, but quality of life is king. You know, and I tell my patients, if you have exhausted everything, and the testosterone, I did a little research after our conversation, topical testosterone has been shown to have some effect and low risk of breast cancer for postmenopausal ER/PR positive women who are on aromatase inhibitors. So if you're a hormone receptor positive and you're postmenopausal, testosterone may be okay for you. The latest study was, I think, 2016. But for, our premenopausal young patients in hormones, we got to be a little bit careful. Talk to your docs about it, because, early stage breast cancer, your survival is excellent. But if your quality of life, if you're not living, what good is it? What good is it? For my patients, I recommend moisture, vaginal moisture with Replens, which is a suppository 3 times a week. So 2 to 3 times a week with some sort of a vaginal moisturizer. Just like you exfoliate and you moisturize your face, you should moisturize your vagina. I tell my patients to get a little box, get a little pleasure chest, and keep some things in there, So we got our CBD over here. We can put some liquid coconut oil. You can find that in the kitchen section. It does not have to be in the jar, the cream. You can get the liquid coconut oil. You can put it in there. You can get your essential oils, nice smell goods and things, and just have some fun with it. Get excited about the possibility that you just might enjoy it. This could be the best journey. This could be the pivot that you needed. This could be the thing that brings you back. Even if you're tired, even if radiation and chemo and all the things, you still deserve good sex. You still deserve an orgasm. You still deserve pleasure. You can follow us on Instagram, of course, Sisters Network, at Ricky Dove, Dr. Monique Gary on social media, all the different handles. Hey, Tia's back. Tia, tell us how people can can follow you and get involved with you and keep in touch with you?
Absolutely. You can find me on Instagram, and I apologize. I don't know what was going on with technology. It makes me feel like all the stress of it makes me want to go have sex now.
That's amazing. Great stress, but literally, right? Yeah.
Yeah, but you can find me I'm on Instagram, My Breast Years Ahead, my nonprofit, My Style Matters. We're on Twitter, My Style Matters 2, the number 2. On Facebook, Tia Tomlin, Tia with the H, TIAHTOMLIN.
Got it. Ricky,
Right.
how can we find you? We have just a couple minutes and then we're going to have to probably head out of here.
Great. Well, I'm at Ricky Dove, Sisters Networking, and Ricky Fairley on Facebook. So just reach out to us, tweet us, Instagram us. We'll tweet you back, and we'll keep looking at the comments as we always do every week, Dr. Mo. We look at the comments and we try to answer your questions, and don't be hesitate to message us or have a conversation. We want to make everybody happy. That's what this is.
Absolutely.
That's it.
Some people's connection keeps going out. Dr. Donna, we had a question about whether or not some of these qualify as durable medical equipment.
I don't know. I have to say I haven't. I have not had an opportunity to have to try to get that reimbursed. Most of the patients, they actually pay out of pocket for the supplements. And as for the stimulators, I forgot to tell you one stimulator I have. I'm sorry, I forgot. It's called Tracy's Dog. This is a very popular one. And because that goes up against the flat of the vagina as well as the clitoral stimulation. But I don't know if they are reimbursed by insurance.
I'm going to say
probably
not.
Doesn't hurt to ask.
But it can't hurt.
Right.
Can't hurt to ask. Absolutely. Let's see. How about herbal supplements? Any nutritional or herbal supplements that you recommend?
So there are actually, I wanted to touch upon essential oils as well. Somebody's buzzing. Clary sage is a very good essential oil, but one thing we have to be careful with those patients who have receptor positive breast cancers is that there are a number of phytoestrogens in nature that are great for in terms of the natural lubrication of the vagina, but they may also stimulate your receptors, and those are your things like your yam extracts. We want to be careful about those, but those are things for those patients who have who don't have receptor positive breast cancer. Your soy products, your cherries, your apples, all of those are phytoestrogens. Those are very, very helpful.
Couple other things. Excellent hydration. If you are not hydrated, your vagina will not be hydrated.
Right. Drink water. Yeah.
Absolutely. Eat good food and get good rest. Yes. That's what I tell my patients. When your body is under duress and under stress, it's hard to perform. It's hard to function, and it's difficult for us to get in tune with it. So really try to focus and prioritize that rest, that meditation, that stretching. Those are all great things to consider. Even if you don't feel like doing a ton of exercise, you're tired from your therapies, you can get some water bottles and just do arm circles. Nobody's saying you have to do P90X, but get that body moving and get into the practice of really getting in touch with the body and showing yourself some love and some grace, some compassion toward yourself and this body that you have, because we get the one, whatever happens.
We have one to live in. You only have one to live in.
We only have one. I think we better wrap this up because this has been an amazing conversation.
Thank you.
We want to have it again. Dr. Donna, thank you for joining us. I'm so good to see your face. I wish I could hug your neck.
COVID hug.
There you go. Wakanda hugs now. But you can find us social media. Put your questions in theblackdoctor.org, and we will always go back and we'll answer your questions. Please share this with your friends. This has been recorded, so you can replay this at any time. You can go back and watch it again. You can share it with your partners, spouses, friends, breasties, and let's continue having these conversations, because this is the type of stuff that we need to be talking about, and we hope it is real, relatable,
and reliable.
That's what we're all about. The doctor's in.
The doctor's in. The doctor's in. Doctor's in. You guys be safe. Be safe.
Take care, everyone.
Bye-bye.
Bye-bye.